Welcome to UCLA Extension's webcast series on professional certificates. Today we are focusing on transformational leadership in healthcare. I'm your host, Celia Sudri, and I'm here today with Rick Zapala and Shana Lavareda. Rick, who has degrees in law and medicine, is a director in the Department of Humanities and Science and an instructor in the Drug and Alcohol Counseling Certificate. Shana, who has a PhD in Health Policy and Management and a Master's in Public Policy, joins us from the UCLA Center for Health Policy Research, where she's a research scientist and director of health insurance studies. Rick, can you begin by explaining why the certificate was created? Was it based on a need in the industry? And why is it called Transformational Leadership in Healthcare?
Sure. Transformational leadership is really a new management model that is sort of geared towards allowing individuals to create a vision and building consensus around that vision within their organization to really take their organization to a different level. The overall purpose is really to provide them with the ability to increase the quality of the services that they provide while maintaining or really increasing the financial viability of the organization. So it's really a move away from the typical management approach or sort of static management or transactional approach to healthcare, and really to transform. The need sort of arose out of the changes in healthcare policy and legislation which are currently happening. And so this really allows people to grasp those changes and sort of integrate them into their organization in a way that's going to really increase profitability for the organization and increase the quality of the services provided.
Okay, great. And now the certificate does serve a wide range of people. Who is it ideal for? What type of background should they have?
Well, what's really exciting about this certificate is that it's offered completely online. So it's really open to people from all across the world. What we are looking for are people who have some management experience in healthcare, and we're looking for people who already have at least a bachelor's degree in a science or health-related field. It's really an ideal program for people who have already completed our other healthcare management certificate or even our patient advocacy certificate. Those people would be very well suited to transfer into this program as well. So we're really, it's geared towards people who already work in the field and are really looking to sort of take their position to a more leadership role.
Okay, great. And now, what careers does the certificate prepare you for? How can that make you a more effective leader?
Well, the goal was really to provide people with an opportunity to work in many different sectors. So we're talking about preparing people to work in private and public hospitals, private practices, health care organizations, as well as managed care organizations, consulting firms, even in research institutions or academic institutions.
Well, I think it's very important that people in these management positions are going to be taking a more broad approach, and that's what we're really trying to go for with this certificate program. And so when I think about who this is geared towards, we are affiliated also with the School of Nursing, so that is a right population. And as nurses move into more importance within organizations and are actually taking over more leadership positions and also roles where they are alternate medical providers for MDs in many situations, I think it's very important that nurses and other health professionals know about the system in which they're operating.
And I know that you're teaching a class and you do have a few nursing students. Is that correct?
Right. So in the class that I'm teaching right now, which is the foundational course for the certificate, the student population are all nurses who have had decades of experience working in the field, and they are from across the country. So we don't have local Los Angeles necessarily only. We have people who are in different time zones who can access this class whenever they can around their own work schedules. So it's very flexible. It's an asynchronous class. And the great thing is not only does that give you different perspectives, from different people who've been working in these organizations around the country, but also it allows, this program to be able to reach, so many more people across the country and really have an impact on people that want to, take their organizations to the next level within this kind of new world that we're in now that the Affordable Care Act passed in 2010 and has been implemented, over the last 2.5 years and continuing to be implemented in the future.
I think I just would also like to add that, although the certificate was created in collaboration with the School of Nursing and there's a tremendous amount of interest in the nursing field, it's certainly not limited just to nurses. I think nurses are really in a unique position right now to have an opportunity to be transformative in their field. So we're really encouraging continued participation in the nursing community. But the certificate's also really well designed for people who are MDs or even administrators who really want to take a more managerial role. So while it's not limited to nurses, we're certainly excited to have that level of participation. It really is open to anybody who has managerial experience in healthcare.
Okay, great. And now, what do the changes in healthcare really mean for patients and medical staff? I mean, what opportunities are now available because of it?
Right. So the healthcare system is going through its own transformation at this point. And the Affordable Care Act was passed 2.5 years ago. The Supreme Court let it stand this year. So we are continuing on with changes that really started happening 2.5 years ago, but many people don't even know about those, and are going to be moving forward. In January 1st, 2014, there will be huge health insurance expansions that so many people really don't even know are on the horizon. They haven't necessarily gotten, I think, the public discussion that they really need to have. We're going to have huge expansions in Medicaid and huge expansions in private coverage under these new state-based exchanges. But that's the details. So that happens in January 1st, 2014. And then moving forward from there are other big changes coming down all the way up through 2020. The law was designed to have a 10-year implementation period. And so knowing what that system changes are going to be in the future, as well as what's already happened and what's continuing to happen, I think is very important, certainly for people that are interested in this.
Mm-hmm. And that kind of goes along with my next question about why is this certificate so crucial right now?
It's absolutely crucial. I was just speaking to someone who I gave a lecture to on this, and they said, oh, I never knew these things. And I said, well, it's important for a fish to know about water. At this point, the system that we're in is going to be completely affected by the provisions in the Affordable Care Act. And it's very important for any kind of managerial person or someone who wants to have their organization survive, honestly, and thrive in the new environment, and be able to take advantage of all of the new opportunities that are coming up for funding and also for revenue streams with the new insurance expansions, to be able to operate in this environment.
And a lot of people kind of complain about introductory courses in their certificates because maybe, they feel like they know it already. But why is your introductory class so important, and, how has it been updated to suit the times?
That's one complaint I've never received on this course, is they feel like they know it already. And this is from people that have been practicing in the field for decades. The system-wide approach is incredibly important, and so much people really focus just on their own narrow, and they don't know it's narrow until we tell them what else is out there, but their own narrow viewpoint. Most people know about Medicare, most people don't know about Medicaid and how those two things are different. Most people know about maybe job-based coverage, but they don't know about the private system, beyond job-based coverage. And in my course, what we really do is look at all of those things on a very broad basis and look at the entire system as a whole. And then also every year we make sure, every term that it's offered, because it is offered every term, we make sure to update it with the latest resources and the latest news, because the Affordable Care Act implementation is changing quarter by quarter, month by month. And it's very important to stay on top of those trends and let people know exactly what has already happened and what is continuing to happen.
And what's so great also about Shana's course is that it's really designed to sort of give you snapshots as we move along with what the current state of the healthcare industry is in terms of its design and function, but really also with an eye on sort of identifying what some of the problems are and the issues, and sort of laying a foundation for how to implement the future coursework into solving those problems.
Okay, great, thank you. And now, a lot of us are concerned with salaries, earning potentials. Can you kind of go over some in this industry from the bottom up, or percentages of increase and what their potential could be?
Sure. I think it's pretty well known that the healthcare field is a very rapidly developing and expanding field. In fact, I think one of the statistics that I heard recently was 10 out of the 20 fastest growing occupations are in healthcare. There were stats from the Department of Labor Statistics that indicated that between 2008 and 2018 there was going to be an increase of 16% in this field, with an addition of about 3 million new jobs. So I think it's a really fast-growing industry, and especially with the new legislation and policies that are being implemented, it's really a great time to sort of bring people in a place where they can sort of make transformational decisions about how to implement those things in their organization. Salary-wise, I think people in healthcare administration who are in a managerial position can look to make between $100,000 and $200,000 a year.
Okay, great. And now, how do health insurance policies factor into all of this, and why should students make learning about them more of a priority?
Well, I think it is very important. Providers so often don't know about the financing side, which is the health insurance side. You know, they just kind of think of it as that thing they have to deal with, but really it's the source of revenue for any organization. And the massive changes that are going to be happening in that system are something that's very important for them to know about. The fact that the uninsured population is going to be shrinking so much and has already shrunk by 7 million people since the Affordable Care Act was passed. I think it's very important that providers and people that are looking to be in these transformational management positions really have a good in-depth knowledge of the health insurance side as well.
Okay, great. And then also, what's importance of Patient Protection and Affordable Care Act? How does this affect working professionals right now?
Well, yeah, right now, I mean, really what's going on with the Act in terms of providers is all these demonstration projects. And these have been happening over the last 2 years that the federal government has been providing funding to be able to transform your own organization. And there are some that have been able to take advantage of it. And I think it's very important to know even that those opportunities are out there. So there's preventive care grants, there's movement towards accountable care organizations and getting funding for that. There are all these things. And I actually heard the Assistant Secretary of Health and Human Services say that San Diego County in California has been the epicenter of this change because they've been really on top of this and have been able to apply for and get every single one of those types of grants. And it's very important to know that that kind of partnership with the federal government and being able to draw down those funds to your own organization to be able to improve the quality of services that you provide, that's the point, as well as improve your viability in the future is really out there.
Okay, great. And now, Rick, can you talk about some of the specific courses in the certificate? You know, how is this curriculum based and organized?
Sure. As I mentioned earlier, one of the exciting things about the program is that it's offered completely online. So all of the 8 courses that are in the certificate are offered online. There's 7 core courses which sort of focus in a multidisciplinary fashion on, beginning with sort of the state of the healthcare industry as it is, design and function, and then specific courses on principles of transformational leadership, courses on public policy, courses on epidemiology, courses on cultural competency, patient care, patient safety, high quality care. So it really sort of looks at a really big picture of how to deliver services in the best possible way by looking at all of these different disciplines. The program also culminates in a capstone course at the end, which is really an opportunity for the students to synthesize and apply the knowledge that they've learned in their 7 core courses and sort of address a current problem either within their own organization or within the healthcare field in general.
There's a trend in management style that's changing. Can you kind of go over that a little bit?
Sure. Well, I think we sort of touched on it earlier already. It's really the move between sort of a static managerial position of healthcare, in other words, a transactional kind of approach, and really, capitalizing on this opportunity of change right now and sort of the new policies and new legislation and allowing people to sort of transform their organizations into places that can really provide much better services, ensure financial viability for their organizations, really sort of build a team that really is working towards a common goal.
And I think it's important to also, use the vision word here that, we're trying to have our students be able to create a vision for their own organizations and then be able to move towards that vision and know how to build the consensus in the team that can go there.
Okay, great.
Right.
Thank you, Shana and Rick, for joining us today, and thank you for watching. I hope that this webcast has been helpful. For more information, please visit uclaextension.edu/TLHC, and it's been a pleasure. Thank you.